So we get dispatched to a call, and when we get on scene, we may or may not know that this is a heat-involved emergency, but when we find the patient, we're checking the temperature early on, and we're looking for the temperature to be over 104 degrees. If it's over 104 degrees, we're checking to see how well are they talking to us. Are they able to understand what we're saying? If they can't understand what we're saying, if they're unconscious, if they have what we call altered mental status, okay, removed from their baseline of being able to talk to us, we're going to use this rapid cooling bag. As I said before, this is a non-permeable bag. It's got handles on the sides, and it can support the weight of any patient we can fit in here. Okay, and so we remove the patient from the heated area, whether that be the pavement or the concrete. We want to make sure we remove them so we don't increase the duration they're on it and create further burn injuries. We're going to place them in this bag. There's a lot of things happening at this point. We're starting multiple IVs to give them cold fluids. We're assessing their vital signs, their heart rate, their blood pressure, their pupil reflex. And once we have them inside here, we're going to be very quick to add ice to this. So every Phoenix Fire truck, every Phoenix Fire ambulances have these coolers or similar type coolers in them, and every day we fill them with ice, and all we're going to do is we literally just start filling the patient's compartment with as much ice as it'll take. So for smaller people, it might not take as much ice. For larger people, you're going to need a little bit more ice, and that's why it's important for every Phoenix Fire truck to have them. Not just the fire trucks, but the ambulances as well. We grab ice from multiple units, and to apply this throughout, again, is to reduce their temperature before we get through the hospital doors. And if we want to reduce their temperature below 104, we actually want to get it between 38 and 39 degrees Celsius is what our protocol calls for. So that's 102.4 degrees to 104.2 degrees. And what we want to do is we want to get them below that temperature before we walk through the door, under 30 minutes. And that what we've seen is an increase of survivability with those patients. And so we would just continue to fill this up. We're going to load them up into the ambulance. We're going to zip this up. And what we do is we keep this flap open. This allows us to treat the patient. We can still work on IVs. We can administer medications if need be. We can monitor the heart rate and the vital signs from this point. For somebody this size, I would use all of ours.
So what do you guys do, like at the beginning of the shift or something like that? And just
every shift we check off all of our trucks. Every piece of equipment gets checked off at the beginning of each shift, including our EMS equipment, and that's actually how they look. We can sit at the head of the patient, we can assess them, we can deal with any airway issues, we can continue to have IV access when we pull their arm out here.
Okay.
So,
how do you take their temperature?
So we use a tympanic thermometer, so it's in the ear.